State health officials have confirmed a metro area man has tested positive for the orthopox virus. The CDC will have to confirm whether the man has monkeypox, but the agency's top doctor on this investigation says it's almost certain it is the virus. And that's our top story today. Thanks so much for joining us. For Fox 5 News at 4, I'm Christine Spiro. Public health officials have placed the man under an isolation order. It requires him to stay at home until his symptoms resolve. Meantime, a sample from the man is being tested at the CDC lab here in Atlanta. The Fox Medical team's Beth Galvin here with this latest breaking story. And Beth, what do we know about this patient?
So Christine, the details are pretty sparse, but the Department of Public Health says he does have a travel history. We don't have particulars about where he traveled or where he is being treated other than that he is at home in the metro area. The CDC is investigating 17 confirmed U.S. monkeypox cases across 9 states right now. Most, but not all of these cases involve people, most of the men who traveled outside the country to countries that are experiencing outbreaks of this monkeypox virus. And we spoke a few minutes ago with Dr. Jennifer McQuiston, the CDC's point person on this monkeypox investigation, about what they have learned so far.
We're still learning a bit about this outbreak and what is driving it. Traditionally, we think of monkeypox as a disease that spreads in some parts of Africa, maybe with people who have contact with animals in the jungle or something like that. But clearly, this outbreak is spreading differently. There are a lot of cases being reported out of Europe that their primary reported exposure is going to be intimate contact with somebody who likely had monkeypox. So could be sexual contact, could be direct contact, skin on skin contact. Monkeypox is actually spread most commonly when somebody has a rash and those lesions are infected. So if you touch those lesions, you can get virus and then transmit it to yourself. So that's the most common way monkeypox is spread. The important thing is if somebody does have a rash and they think it might be monkeypox, they should go talk to their provider, and their provider can work with the state health department to get the right tests, and they should refrain from close contact with someone until they get that checked out.
And again, the CDC lab is still confirming that this Georgia case is indeed monkeypox, but Dr. McQuiston says it almost certainly is this virus. And that is how state health officials are treating it, getting an order of isolation to keep this patient at home until his symptoms resolve. And we're going to talk more at 6 o'clock about the telltale symptoms of monkeypox, especially that rash and what to look for. And Christine, Dr. McQuiston really saying that, this is concerning because we are seeing monkeypox spreading in a way it has not spread before, but we're really not talking about pandemic potential right now. We're talking about only 17 cases. Monkeypox requires really close contact, so it's not likely it's something you're going to run into at the grocery store or out running errands. So just to kind of let people know that this is concerning. It's not alarming, and we shouldn't be alarmed.
We're not hitting the pandemic button on this necessarily,
we
right?
are not.
But
we are
it's
not.
something to pay attention to.
Yes.
All right. Thanks so much, Beth.
Yeah.